I mean, I think if there's a group of you, so you can really potentially offer help, meaningful help, then it's of great value. Van and I did a lot of things where there were just the two of us, and to be honest, I think achieving much with one untrained person would be very difficult. But these guys, you know, they're intelligent. Someone could be injured, and there's no reason at all why, if 3 or 4 people kind of know what they're trying to aim for, that you can't get something valuable out of it in terms of care. So I think it's valuable. Well, I guess you could question the value of pretty basic training in terms of such an isolated place, but I reckon it's of considerable value in the sense of someone could be injured really quite significantly, but things can be done to stabilise an individual and even then to look after them for weeks or months. So, you know, there's that first few minutes issue, and having the whole group able to know what they're aiming for is meaningful, and I'm glad that they're doing it. Yeah, certainly it's always struck me that being the doctor involved in these things, I'm not being overly wise in who's going to look after me. And I think that was particularly true when just Ran and I did things. You know, just one person that's not particularly well trained isn't going to be able to achieve very much if I was severely ill or injured. But with a group, I think that's a bit different. 4 or 5 people that kind of can work together could do something valuable for me, and there's communications, and so yeah, it's worthwhile. Well, obviously, all of them have had a bit of first aid type training before, and I think this course is going to contribute significantly to how competent they are in that first primary phase of care. And in a sense, they should be able to reach a standard that's not much different to me. I think the difficulty comes in that once someone is injured and then, you know, they've survived and you've moved them indoors, you're isolated, and that potentially long period of secondary care, I don't think they're going to be able to offer very much, whilst I would hope I could offer something. I mean, I think if you're in a very isolated place and you're talking about particularly severe injury, and of course that could occur quite easily, you've got to view it as being 2 different stages. And the first stage, which is about immediate action, is a paramedic stage, and in many ways there's no reason why I am able to perform that much better than anyone else. You know, if they've been through it and thought through it, it's a question of trying to get that person at least you know, their airway working, they're not bleeding, and you've got them stable. The second phase, which is what you do then if you can't get them out, which is likely to be the case, I think is very much more difficult, and that's when a doctor is of some value. Oh, I think it is important. I think we're going to be in an environment where injury, significant injury, could really occur. I mean, we're operating with big vehicles in a place where seeing and hearing and things is really difficult. The unloading phase, you know, someone could get quite a significant injury, and you could save their life if you know what to do, and you could then look after them. So it is a real phenomenon and really worth addressing. I mean, as it happens, I've faced relatively few demanding situations on all the expeditions I've been on. Perhaps the most worrying was when someone was blown over. I mean, it sounds crazy, but was blown off I suppose, a sort of slanting slope and fell on his back on rock. And I did wonder if he'd ruptured his spleen because he was really quite badly hurt, but he hadn't. So. I expect to learn useful stuff. As doctors, you don't train to operate away from facilities, and I mean, although I've had some training on that before, this is going to be a very useful reminder, and I guess that I'll also get some top tips from about how to operate in a remote environment. I operate within facilities that are very sophisticated. I'm good at that, not so good at this.